Hi, my name is Yannick Dentis. I am a family nurse practitioner based in West Palm, Florida. So I want to greet everyone who is listening and viewing the posters. So I have chosen to use posters to teach about health promotion and disease prevention. So you can use those posters, you can look at it, and at the same time, I am going to read what is in the poster. As you know, the goal of this video is teaching only. So if you have any medical issues, so I advise you to call your provider so they can guide you. As usual, we are going to start with the Word of God. Okay, what God said about healing and the sick. So if you go to Matthew 10, verse 8, Matthew 10, verse 8, what God said, He said, heal the sick, cleanse the lepers. This is kind of skin disease people had. Raise the dead, cast out demons. Freely you have received, freely gives. So this is God's words regarding healing the sick. So it's important when we are sick, we search how you can get treated. Go to see your provider, whatever they prescribe you, you need to take it, and this way you will have an optimal health. So let's use the poster. Managing diabetic is as simple as ABC. This is the title of the video. However, you really need to be consistent. Take your medication, see your provider. Your lab works need to be done on a regular basis. A stand for hemoglobin A1C. Hemoglobin A1C, this is the standard blood test we use to monitor your blood glucose over like few months. Usually they said like 3 months. So hemoglobin A1C below 7%. That blood test reflects your blood glucose control over the past few months, usually 3 months, as I said. So you always have to work with your doctor to have your own personal A1C goal. Everybody is different. It's not one size fit all. Depending what kind of what kind of medical problem you have. So everybody is different. So work with your doctor so you can know your personal hemoglobin A1C goal. And every 1% above 6% elevated that blood test, which is hemoglobin A1C, you are at risk for diabetes complications. So that's meaning more your hemoglobin A1C is high, it's more you're at risk for diabetic complications, such as blindness, complication for your heart, or foot ulcer, you name it. Your blood glucose will stay lower when you exercise and restrict your calorie intake. So which means when you have when you are diabetic or when your blood glucose they are high, it's very important to exercise, and also your diet is very important in order to control your blood glucose. Okay, and blood pressure below B is for blood pressure below 140/80. So they aim that, according to diabetic association, they want the blood pressure below 140/80. Up to 60% of people who have diabetes also have high blood pressure. So that's how we call metabolic disease. Metabolic disease tell you there's something not right, in your blood or in your body. Once you start having diabetic, the little cousin of diabetic is high bad blood pressure. Then you're going to have also high cholesterol, high bad cholesterol, all those things. So that's why you need really to do stuff, to change your lifestyle so you can have a normal blood glucose and blood pressure. High blood pressure can cause what? It can cause a heart attack, affect your heart. It can affect your brain, your stroke, can cause stroke, and can affect your kidney disease. So you will end up with kidney disease, and at the end, you will go to, dialysis if it's not controlled. And also, blood pressure can stay low so you can prevent having high blood pressure by reducing your sodium in your diet, so your salt. And also, they recommend you follow the DASH diet. So the lowest systolic target, which is the top, the top part, such as less than 130, that's maybe good for some individuals, such as, younger patients. So they see the associate for cholesterol in check. When the provider told you have hyperlipidemia, that encompass different type of lipids. Okay, it could be your cholesterol is high, could be your LDL, which is the bad cholesterol is high, could be your good cholesterol, which is your HDL, could be low because the HDL is supposed to be high, the good one. And your triglyceride also can be high. So that's why they said hyperlipidemia. So it's it's a sum of your fat who are who is high. But sometimes we see people who have good, the HDL is high, the LDL is low, which is fine, and then their cholesterol, they are high also. So the LDL goal for most people is below 100. So for most people, your LDL, which is the bad cholesterol, so if you want to remember, so L for lousy, okay, LDL, bad cholesterol, it's supposed to be less than 100. This is the range. So if your LDL is less than 100, it's perfect. So the lower is your LDL, the better it is, and it's less risk of heart disease you will get. So the HDL, which is the good one, so usually in order to remember that, we said, the H for high, So the goal for most people is above 40 for men and 50 for women. So the higher is your HDL, which is the good one, the better it is to prevent heart disease. And also, they recommend you keep your triglyceride. This is another fat. Your triglyceride is supposed to be lower than 150. So, for prevention, all those numbers to prevent, complications. So those numbers supposed to be at that range. LDL supposed to be lower than 100. HDL, which is the good one, supposed to be above 40 for men and above 50 for women. And your triglyceride supposed to be lower than 150. If you have diabetes, you are more prone to cholesterol abnormalities and heart disease. That's what I said before. So that's why we have to try to keep them low as much as we can. Except the HDL, which is the good one, it has to be higher. The higher is your HDL, the better it is to prevent heart disease. So LDL or bad cholesterol can clog your blood vessels and cause heart attack or stroke. So that's why we need to keep it as low as possible, because we don't want your blood vessels to be clogged. Your LDL target may be lower if you have cardiovascular disease. So you need to talk to your provider so they can have a regimen, treatment for you. Because if you have a cardiovascular disease to begin with, like let's say you have hypertension, you have angina, you have myocardial infarction, your MI is very, very important for your LDL to stay low as much as possible. So LDL stays low when you eat less saturated fat and cholesterol from animal foods. HDL, which is the good one, okay, your good cholesterol help remove the bad cholesterol, help remove cholesterol from your blood vessels. So HDL stays high when you exercise, eat fish, when you eat soluble fiber, and you live a healthy lifestyle. So people can say, what is a healthy lifestyle? A healthy lifestyle, trying to lose weight if you are overweight, exercise, and diet. So that's why they meant by healthy lifestyle. So now we are going to go over natural medicine for those conditions. So the natural medicine for diabetes, okay? Usually when I said diabetes, it's primarily diabetic type 2. Mostly we found in adults. So the natural medicine, the literature recommend, and I advise you to go and research, on those natural medicine herbs. So for diabetic type 2, we have bilberry, sriracha, garlic, guava, stevia. So those natural one, it's good for, if you have diabetes type 2, that will control your blood glucose according to literature review. And for your blood pressure, for high blood pressure, natural medicine, they advise for you to take is American ginseng, breadfruits, cat's claw, coconut. That coconut, I really believe is true, because if you drink coconut water, it make you urinate a lot. So more you urinate, it's better is your blood pressure. So that's a good one. Dandelion, donkey, garlic, ginger, parsley. So most likely those natural medicine, that's why they call it natural medicine chest. Most of them people have them at home, and which is good. Like ginger, parsley, garlic, coconut. Most likely we have them. So this is all those natural medicine that literature review state that state is good for your high blood pressure. And also soursop. Also, they said it's good for high blood pressure as well. And we have more more herbs, more natural spice who cooking, but mainly, those one I just tell you they are, they are the one who which they advise. And natural medicine for cholesterol: garlic, ginger, ginseng, green tea, guava. They said milk thistle is good, turmeric, wheatgrass, and etc. So you can see the garlic and the ginger, that repeat. So it's good for high blood pressure. It's good for your cholesterol, which is good. And there is one also, oatmeal. Oatmeal is good for your It's good for your cholesterol, also. And also, it's always good, you do your own research. You go to a health food store. You ask, when you inform, when you know, when you educate yourself, this is the best gift you can give to yourself. Education is priceless. That's why being a nurse for like since 1989, and I became a nurse practitioner in 2001. So I've been working with so many patients, and I see things. So the mostly people needs, education. Also, you need to know why you are taking medicine. When you are on medicine, you need to know why. If you have side effect, you need to call your provider and let them know. You don't stop your medication like that. The doctor needs to know, the nurse practitioner or physician assistant, they need to know. If you stop them, sometimes they can give you something else. They will call you back at their office, and they will check lab work. So you need to work with your provider. This is a must. Health. I think health is the best gift God can give us, because I know everybody wants to get rich, everybody wants to get money, but guess what? If you don't have health, even though the money cannot do anything, you can have all the money you want, you won't be able to use it. So you need to be healthy first. So make sure you take care of your health. Make sure you read about how to stay healthy. If you have high blood pressure, how to control your blood pressure. And talking about blood pressure, your provider can put you on lisinopril, you can be on metoprolol, you can be on water pills, furosemide. All those things is for blood pressure. You need to know why you're taking, because the compliance, I realize, is when you don't know when you don't know why you are taking a medication, that's why you not comply. But if you know why you take it, so ask your provider why I am on that medication. Ask them. So this way, that will give you focus. That will give you motivation to take your medicine. For instance, if you have diabetes type 2, Diabetes type 2, they might put you on metformin. Some they started, some providers started like 500 milligrams twice a day. They might put you on glipizide also. They might put you on insulin. There's different insulin. You have, the old ones, your Novolog, your regular insulin, your Humalog, and you have the newest one, the Aspart, which is the fast-acting, and the Lantus, which is the Glargine, which is the long-acting. You have to remember, you have to take them, as recommended. As your provider told you to take it, you take them. And that will really prevent complications. So on that, hopefully hopefully you have learned something, and thank you for listening, and thank you. And that poster, you can, view it, and the natural medicine, you can, make some tea, like me, in the morning I use my garlic, I use my parsley, I make a tea, infusion, and that will help you, you drink that. So any simple thing will help, any little things. So on that, I will tell you that we will discussing next topic very soon. So please just like and subscribe. So if you subscribe, whenever I post, whenever I will post a video, it will it will notify you. So on that, thank you, and best of health. Bye-bye.